All right, 10-minute snack. Everyone knows the rules. Let's eat. Okay, so we have Dr. Philip Ovadia today here with us, heart surgeon. He's done over 3,000 heart surgeries. And today, in this short snack, we're going to try and figure out how to not be number 3001. Dr. Ovadia, thanks for being on.
Great to be here with you, Kevin.
So, one of my questions is, or something that I've kind of always been curious is, I always look for kind of Occam's razor. What's the simplest explanation? And cardiovascular disease, number one killer worldwide. I think cancer is on its heels. But my question is there an Occam's razor to cardiovascular disease, or is there a main contributor or cause? What's causing us all to die? What's causing our hearts to give out on us?
Yeah, so I think when you look at the studies on, the causes of heart disease, there is a clear Occam's razor, and that's metabolic health. And we can measure this in a number of different ways. But consistently in the studies that are done, metabolic health, insulin resistance comes out as the number one risk factor for heart disease. So that's where I think we should be starting. But unfortunately, as you know, that's not the mainstream messaging.
Yeah, absolutely. Now, if we pull on that thread a little bit, if it's all right with you, what is the main contributors of poor metabolic health? I know we'll go into probably poor diet, but maybe we can start to unravel that a little bit.
Yeah, so certainly poor diet is number one. And when we look at the specific components of the diet that, damage metabolic health, again, we get to processed food in all its forms. And, we can argue about what it is in the processed food. Is it the highly refined sugars? Is it the vegetable and seed oils? Again, I kind of stay high level with my patients, and it's processed food. So let's just eliminate processed food. And what does that leave you with? It leaves you with eating, whole real food, meat and plant matter. And that again consistently comes out as the best way to maintain your metabolic health and therefore to maintain your heart health.
So upsetting when the answer seems so simple, right?
I
Right?
know,
Just eat real food.
we make it complicated. One of my favorite sayings is that humans are the only species smart enough to make their own food and dumb enough to eat it.
That that is the truth. So I kind of have a personal question, and maybe it's diving a little bit to a little bit less high level, more into some of the minutia, but any views on vitamin K2's role in heart health?
Yeah, so I think vitamin K2 plays a very important role in heart health. I think again, primarily we should be getting that from our diets, and the primary source of vitamin K2 in our diets is going to be animal products, is going to be meats. But for many people, I recommend it as a supplement as well, because it has been shown to be useful in stopping the process and maybe even reversing the process of arterial plaque formation and calcification. So I'm a big fan of vitamin K2. And as I said, try and get it from your diet first. If for some reason that's not possible, or you want to, get extra and be even more sure about it, then supplementing it is good as well.
I love that. It's vitamin K2 has been one of those, I feel like, the most underrated of maybe the vitamins. And as a dentist, and I've studied the work of Dr. Weston A. Price, which I think he was talking about vitamin K2 when he talked about activator X.
Correct.
But it plays an special important role in oral health and making sure you have strong teeth, et cetera, et cetera. But the studies you mentioned and how it can help prevent, even perhaps reverse calcification of arteries is pretty fascinating.
Yeah, and it's real interesting when you look at, just as like you said, we see that it helps with oral health, and we see that it helps with heart health, and we know that there's a strong relationship between oral health and heart health. Again, that's something that has been shown consistently. And one of the theories going around is that if the bacteria build up if your oral biome, starts to shift, and those bacteria then get into your bloodstream, and that can then cause inflammation in the arteries and cause heart inflammation. That may or may not be true, but the bottom line is, it's foolhardy to think that what helps one part of our body isn't going to help another part of our body. Our bodies are a system, and ultimately what benefits one part benefits all parts. And so, we can find many examples like this where we start trying to improve our oral health and we end up improving our metabolic health and our heart health.
Yep. I love that, because I agree wholeheartedly. One of the things I'd like to say is the reverse of that, is that if the strongest substance of your body, enamel, is decaying, it likely means other things in the body are also going wrong. It's not that this is just some isolated issue on a tooth. So I think it can be looked at both ways. And I know we're running out of time. One last question I got to ask you, because I'm a big advocate of meat eating, big meat eater myself, especially red meat, lots of saturated fat. What any kind of like parting wisdom around saturated fat, LDL cholesterol? This is kind of the two big fears of people going to a more heavy meat-based diet. Maybe their LDL goes up a little bit. They're eating more saturated fat than they ever have. Any parting words of wisdom there?
Yeah. So, the bottom line is saturated fat has clearly demonstrated that it is not a concern regarding heart disease. And we have, the American Heart Association has actually taken out the limits on saturated fat from their guidelines. It's just that they didn't do that publicly, and no one realizes that. The U.S. Dietary Guidelines Committee has also said that, saturated fat is not a nutrient of concern. So it's really it's a settled question. It's just not settled in the public's mind because we had so many years of messaging around saturated fat. And, the LDL story is a similar story. It is a nuanced and complex issue. And ultimately, it's not something that can really be sussed out on social media or in a, quick little clip. But, what I tell people is, if your doctor can't assess your heart disease risk beyond looking at one number, your LDL cholesterol number, it's time to find a new doctor, because that's simply not an adequate assessment of heart disease risk. And I think, even the most ardent lipidologist out there, will agree with that and have agreed with that in conversations that I've had. And so go beyond LDL cholesterol is kind of my main message around that.
I love that. And like you said, I'm frequently saying saturated fat has been exonerated, even by the laggards, but it just hasn't kind of made it to, I guess, mainstream consciousness yet. So, Dr. Ovadia, I want to thank you for your time. I want to mention your book, Stay Off My Operating Table. Don't be number 3001 or any beyond that. And I enjoy following you on Twitter. Anywhere else people can follow you, learn more from you?
Yeah, Twitter is the main place, but my website, ovadiahearthealth.com, has all my information. And I have a free tool for people. If you go to ifixhearts.co, you can have your metabolic health assessed. I have a quiz there that will help you assess your metabolic health. And then iFixHearts is where to find me on social media.
Excellent. Thank you so much, Dr. Ovadia, for the time today. And we'll have all that linked below as well.
Great snacking with you, Kevin.
All right. Thanks, Dr. Ovadia.
Snack time's over. Did you enjoy the snack? If so, drop me a comment. Let me know if we should dive deeper and do a full meal on this topic. Also, P.S. if you liked the snacks, you're going to love our bites. A daily email bite, a golden nugget, better than a pasture-raised egg yolk. All right, maybe not that good, but it is a daily bite to optimize your health and nutrition with a meat-based diet. Access right now is totally free. Link below. See you in the bites.